Good afternoon, everybody, and welcome to our latest QPS Talk Time. Today, we're talking about Voices Together, co-designing an outcomes-focused monitoring system to support continuous QI in Disability Day Services. You're all very welcome this afternoon. We know a lot of you are joining on your lunch break. Some of you are in groups, some of you are alone, but you're most welcome. So today you can follow us on social media. As I said, on YouTube, you'll be able to watch back any of our QPS Talk Times on National QPS. You can follow us on LinkedIn for details of upcoming resources and webinars from the National Quality and Patient Safety team. And you can also listen back on Spotify at QPS Talk Time. And what I'm going to do is we're going to pass on to the next slide, and we're going to just share, I suppose, the session outline today. We're going to talk about the trial of the co-designed outcome-focused monitoring system to support continuous QI in Disability Day Services. And it is a trial, but you'll hear a lot about the work that happened to co-design this, to make it happen, and the involvement of people on a day-to-day basis in this work at the moment. So you'll hear from both assessors from the HSE and those with the lived experience from the monitoring trial, and we'll share lessons learned on the impact of the work today. There'll also be an opportunity, if you've got questions, that you can ask us questions that you might have, and we'll put those to the panel as well. So today's speakers, you're going to hear from Jerry Tully, who's our Assistant National Director of Adult Disability Services, Dr. Deirdre Nally, who's from the National Disability Authority. She's a Policy and Public Affairs Advisor. We'll have Martina Lanigan, who's our HSE National Day Services Coordinator, Jack Kenny, who's the Assessor with Lived Experience, Niamh Dunn, the HSE Assessor with Lead Responsibility, and Teresa Gadd from ACE Communications. And each of these have been fundamental in making this process work. So I just want to welcome them all and to say thank you so much for joining us today. I'm looking forward to linking in with each of you as we go through the panel. And for you, if you've got questions for the panel at any stage throughout the process, feel free to pop it in the chat, and I'll do my best to ask those questions as we go. So we're going to start off with just a brief introduction from Jerry Tully, and it was a short video clip that he's recorded to share with us. So we're going to pop that up and share that now.
Good afternoon, everyone. I'm Jerry. I'm an Assistant National Director in the HSE, working in Access and Integration. I have responsibility for Adult Disability Services. I chair the National Monitoring Steering Group for this work, and I'm really delighted to be here with you for the QPS Talk Time webinar. Our focus is on reimagining Disability Day Services so that they truly respond to people's needs and wishes. It's about making sure that what we do makes sense in people's lives. This work connects closely with the HSE's Better Together roadmap, which guides how we engage together with people who use HSE-funded services. It reflects a real shift in how we work, moving towards genuine partnership and co-production. We want people to be involved at every stage, co-designing, co-deciding, co-implementing and co-evaluating, all with clear focus on continuous quality improvement. That means we're always learning, listening and finding ways to make services better. Day services have a strong tradition of partnership. Together with our umbrella body providers, we've developed key initiatives like the new directions policy, the interim standards and person-centred planning. And it's great to see that tradition of partnership continuing, with people who use day services now at the centre of shaping and improving how services are delivered and monitored. I want to take a moment to thank everybody who's been part of this journey. Your collaboration and commitment has made a real difference. Partnership is truly at the heart of everything we do. I want to acknowledge everybody involved in our working groups, people supported by day services. The National Federation of Voluntary Service Providers, Disability Federation of Ireland, and the National Disability Services Association, Inclusion Ireland, and the Department of Children, Disability and Equality, and especially colleagues on the panel today, an assessor with lived experience, National Disability Authority, ACE Communication, and HSE Disability Day Services team. It's a real team effort, and I deeply appreciate everybody's contribution. For us, day services are about doing things with people and not for them. That's such an important principle. We want services that support each person's strength and potential and empower people to take a part fully in their communities. And this work is built on strong partnerships, good governance, sustainable resources, and most importantly, a shared commitment to keep improving. I am truly humbled, in the very best sense of that term, to be part of this work, and excited to see how this partnership approach will continue to strengthen Disability Day Services into the future. Finally, a big thank you to Anita and the QPS TalkTime team for the invitation, and I'm looking forward to hearing from people who avail of Day Services support, because their voice and experiences truly bring this work to life. Thank you very much.
We're going to go over now to Deirdre and to Martina, and they're going to share a little bit about how this process started and what it is. And we have a short presentation to share with you as part of that, and then we'll have an opportunity for more conversation. There's lots of comments coming in the chat, and as I said, we've got people from all across the country joining us today, and really interesting to see that similar trends are coming up in terms of what matters to us. So thanks for sharing that into the chat. So Deirdre and Martina, over to you.
Oh, thanks, Juanita. Good afternoon, everyone. I suppose I'm going to tell you a little bit about how did we get here and the journey so far. So the HSE supports 22,000 people with a disability to access day services, and these are all delivered across 97 provider organisations in 1,200 day service locations nationwide. And I suppose they aim to support each person to live the life of their choosing. They're guided by the New Directions core policy, the policy principles, which is person-centeredness, active citizenship, community inclusion, and quality services. And as we all know, the quality of our lives depends on the quality of our relationships. And that's really what we want to focus on in developing the outcome-focused monitoring system. So you might ask, well, what is the monitoring? What do we mean by that? And what is it really? You know, and Juanita talked about, you know, what matters most. Well, how do we know we're working on what matters most to people? So in 2023, we began this work, and, you know, in developing a way to monitor all of this in partnership with the NDA. And since then, you know, the HSE standards were ratified in 2015, we've been on this journey of continuous quality improvement in day services. So providers, you know, are very familiar with the approach around evaluation, action, and service improvement. And that's the EASY process for short. So this means constantly reviewing and improving services together with people we support, staff, and management. Our monitoring, I suppose, it's not just about tick boxes or compliance. It's really about listening and learning and improving. It's about partnership, and it's about bringing people who receive a day service around the table and being guided by them. And with that, I'll hand over to Deirdre, who'll talk to us a bit more about how we're using that partnership in developing a new way of evaluating day services.
Great, thanks, Martina. And so just to say, so I'm Deirdre Nally, and I work as a policy and public affairs advisor with the National Disability Authority. And myself and my colleague Ruth O'Reilly, we're supporting the HSE in this work. So I'm just going to talk a little bit about, I suppose, the partnership-based approach that we're taking, how we're shaping evaluation together, and I'll discuss a little bit of the journey so far on the work that we've done in developing and co-designing the monitoring system. And then I'll finish off with just a very high level, I suppose, introduction to what a monitoring visit looks like as of now. And why I say that is because this is all part of the co-designing phase. What we have now could be very different to what we have by the end of this project and this process. So I'll start with, I suppose, why are we taking a partnership-based approach? And I suppose the answer is because it's the right thing to do, and the results are better. It's really as simple as that. The United Nations Convention on the Rights of Persons with Disability obliges governments to involve disabled persons and disabled persons organisations in high-level decision-making processes. And that really is a key driver for us, as well as, I suppose, the HSE's national strategy and the Better Together roadmap. So there's a lot of drivers to do partnership. But also, when you think about it, we want to improve the quality of services. And kind of as Martina was saying, to know how to improve the service, you need to talk to people who are receiving services and supports to know what matters most and to know what are the things that we need to focus on and improve on. So they're the two drivers of why we're really taking this partnership-based approach. And I suppose we leaned on 2 documents in the very early stages, and I'd recommend these documents as they provide a really practical guide on how to do participation with disabled people. That is the National Disability Authority's Participation Matter Guidelines, and another document developed by the HSE Inclusion Ireland and the Independent Living Movement of Ireland, from consultation to co-creation. 2 very useful documents that really provide practical advice on how to make participation work, essentially. So on the next slide, then I'll just want to talk a little bit about the journey. You know, we started a few years ago. One of the key starting points really was a workshop that was held in June 2022, where we asked stakeholders, what is it that you want to see in a monitoring system for day services? And it became very clear that we needed a monitoring system that put the person, you know, who's receiving the services and supports at the very heart, at the centre of this. And it needed to build on all of the good work that's already happening in and around day services sectors to improve the quality of services. So that was 2 key messages for us, to build on work that's already been done and to ensure that people who attend day services are at the centre of it. So then following this workshop, then I suppose the subgroups were developed. So as Jerry mentioned, we have a steering group, and under the steering group, then we have 2 subgroups. So we have the outcomes focused working group, which is the group that really kind of looks at the technical, the frameworks, the methodologies, the approach that we will take to monitoring. And we have the day services Voices Together subgroup. So that subgroup is really about ensuring that the voice of the person who's attending the day services informs how we are co-designing the monitoring system. We have within that group as well, they create communications to people who are attending day services, so they are informed of the development of the monitoring system. So in the last year, really a lot of our work has really shifted towards this Day Services Voices Together subgroup, and it's a really pivotal, it's a really important subgroup at this moment in time. And I think Teresa will talk a little bit about some of the resources that are currently underdeveloped. I think all our members of that subgroup have resources to work on over the next coming months. So it's a really busy, really important subgroup for us. So once the subgroups were developed, I suppose we wanted to do a national consultation, and we consulted with people supported, families and staff who work in day services. And again, the Day Services Voices Together subgroup, they developed the family survey for the national consultation. So again, really central to the work that we're doing. And from that national consultation, we spoke to 78 people supported. We got over 1,800 responses from the family survey, and we spoke to hundreds of staff around the country. So we got feedback from roughly about 2,500 people, which was huge. And it's so important, this consultation, because we refer to it all the time of, okay, how are we going to design and work through this monitoring system? So after the consultation, we had an idea of what monitoring could kind of look like for day services. So now we're at the stage of where we're trialing, where we're piloting, you know, what was told to us in the national consultation to see what's working well and what's not working well. So just in the next slide, I'll talk to just what that trial looks like. So where we're at right now. So I suppose when we were developing the monitoring system, it became very clear that there's no off-the-shelf monitoring system that we can use and apply to day services. And the only way of knowing what we're doing, if it's working or not working, is by trying it out, testing it, and getting feedback from people. So it's a huge undertaking, I suppose, to develop a monitoring system. So what we did is we broke it down so we could take it step by step and work with people as we go through the different steps of understanding what works and what doesn't work. So we broke it into three steps, I suppose. The first step was information gathering. So how do we go about gathering the information before and during a monitoring visit? The second step then is we want to look at and say, okay, we've got the information. Now, how do we know what story is it telling us? What is it telling us about the experiences and outcomes of people supported? And then in the following step, then we put it all together and we undertake the entire monitoring visit. So what we've done is early on in this year, we've gone through the first step, the first block 1. So that was from April to June, where we did a number of monitoring visits, and we looked at our methods and methodologies for gathering information before and during a monitoring visit. And we've paused over the last few months to gather the feedback and to see what's working, what's not working, and what needs to change. So now, as of next week, we'll be going into block 2, where we're now going to gather the information and also triangulate that information and try and understand the story that it's telling us of the experiences and outcomes of people, and also what is the quality of the services and supports. So as well as, I suppose, we, you know, in the trial, we're developing the methods and the tools, but we're also very much developing our monitoring team. And that's a huge piece of work as well, because this is, you know, we have to design this from the ground up. So we have, our monitoring team consists of an assessor with lead responsibility. So we have project managers in each of the areas within the day opportunities teams, and they're stepping into the role of the assessor with lead responsibility. So we have Niamh today, who will talk to you a little bit about that role and her experience of it. And we also have the assessor with lived experience, who we have Jack today, who'll tell you about his experience of it. And for the purpose of the trial, we have a support assessor for the trial. That's because we're learning, we're developing. So the support assessor is another project manager who's there to support the monitoring team. And I suppose I just want to take a huge opportunity just to say thanks to our assessors who've really embraced this. You know, we're learning as we're going. They're stepping in almost to the unknown of, you know, what a monitoring visit looks like. And I just want to say a huge thank you to all of them for helping us and supporting us and you know, really taking this on. It's a huge kudos to them, and also to the providers, because my role in the NDA is we get back the feedback from the providers, and just to say thanks to everybody who's expressed an interest to be part of this trial, and who've provided us with some really constructive feedback that we can take to make this better. So just to take a moment just to say thank you to everybody who's given us feedback as part of this trial as we go and we learn. It's a continuous process, and what we have now today might look very different at the end. So just on the next slide, then I'll just talk about what a monitoring visit looks like today. And I say that, caveat that, and as well, by the time we get to the end of block 3, the end of next year, our monitoring visit could look slightly different. So as of today, we have the first step we have of the monitoring visit is the desktop review. And the purpose of the desktop review is really to support our assessors to try and look at some of that information gathering before they go on the on-site visit. And the idea behind this is that we really want to free up as much time of our assessors when they're on site to be able to speak to people supported, to understand and to gather their experiences. So that's why we have a desktop review. So part of that desktop review, our assessors will look at a provider's self-evaluation tool, their easy tool. And it'll also look at the HSE currently gathers a lot of information from providers, and it'll look at that information. And the idea of the desktop review then is to give the assessors a sense of the location, the services, before they go on site. The next step is an interesting one, the pre-visit call. So in our earlier monitoring visits, we didn't have a pre-visit call, but we heard from the feedback that actually a pre-visit call would be extremely useful from our assessors and from the providers. So now we've built that in as part of our standard procedure. So in the pre-visit call, it's a really important step. It does introductions of hello, you know, and gives everybody a sense of what the day might look like. It goes through the schedule of the day, but it's also about ensuring about how our assessors can engage most effectively with people supported on the day of the visit. So it's a conversation around that. And often, like, for example, a lot of people might be out and about, you know, outside of the day service on the day of the monitoring visit. So it's just knowing what time people are around it and in fairness to our assessors, they're extremely flexible and supportive of that, working around the schedule of people supported. And that's really part of that pre-visit call. So then we have the on-site visit, where I suppose the visit opens with a tour of the day service. And we always kind of ask, if possible, for a person supported at the day service to lead that tour, to show the assessors around what the day service looks like. And after that, then we talk to people supported, we speak to staff, management, and we look at some documentation if it's applicable. So that's very much what I suppose our monitoring visit looks like at the moment. Steps 4 and step 5, the findings and what we do after the monitoring visit. We'll work on that when we get to block 3. But I suppose right now what we're trying to do is to focus maybe really on the first 3 steps and to get them right. And there's a lovely picture here on the slide of Jack and Claire as Jack's support person, and we have our 2 assessors here from the HSE as well. I suppose a monitoring in action. So that's from me anyway, and that's just a quick overview, and I'll hand back to Martina, who'll talk to you a little bit about the lessons learned, because Martina, there has been many.
And we're continuing to learn all the time, Deirdre. So look, to be honest, initially we didn't have someone who attends day services as part of the project group. And it was really through those early meetings and encouragement from providers and the NDA that we began this journey. And we sought representation then from 3 people with lived experience to join and create the Voices Together working group. And Jack, you're one of those individuals who came forward, and a big thanks to you. And the learning here is that this took us a bit of time, and it does take time to work a little differently, but the benefits, I mean, I suppose, look, good things do take time. So what we learned is you work at a slower pace. We needed to ensure the right supports and structures were put in place. And I know, Teresa, you're going to talk more about this in a little while. But this has been the best thing that we've done, in my opinion. We learned that the HSE can't bring about changes on their own. It must work with people who are supported in the first instance and alongside provider partners. So the results are better, and we're focusing in on the outcomes that matter most to people. So as Deirdre said, we're reviewing that feedback at the moment from the first block of the trial, and we are seeing, it's very clear, having people who have experience of day services as part of the project team is ensuring that we got a lot right, because people told us how they wanted the monitoring visits to happen, how, they wanted videos of assessors, they wanted bios, they told us how they want people to come into day services. And I suppose fundamentally this has opened up our eyes, and it changes everything. We really couldn't go back to working in any other way. That shared decision making is creating huge positive change, focusing on outcomes for individuals. So Juanita, I'll hand back to you.
Thank you so much. And that's really, I think, really important presentation there, and really interesting, I think, to touch on some of those lessons learned at the end. I really liked, Deirdre, when you spoke about, to know how to improve services, we need to talk to people using services. And when you look at the patient safety strategy that's there, very often when we look at projects that we share on QPS TalkTime, they've been tried and tested, evaluated, and people have the evidence at the opposite side of it. And this is obviously evolving, but there is that early evidence there and lessons learned that I think it's really helpful to share at this point, because we don't really have the luxury to wait for another 5 or 6 years until there's the launch of an evaluation report for some of the work that we do in quality and patient safety at the moment, because we know that we need to be involving patients and service users now, and in particular those with lived experience. And there's a very good paper from our colleagues Mary Dixon Woods and Graham Martin, and they talked about patients as knowledge brokers, and service users as knowledge brokers. They have that knowledge and expertise and can facilitate sharing that. So what we're going to do is we're going to go to Teresa Gadd, who is a company director with ACE Communications, to talk about her role in this work. And then we're going to have a chat with Jack and Niamh, who are assessors, about how it actually works in practice. So Teresa, you're very welcome.
Thanks, Juanita. Good afternoon, everybody. So I'm going to tell you a little bit about how ACE Communication have been involved in monitoring, and really mainly it's been twofold. So I was commissioned to be involved in doing the consultations with people supported, and out of that consultation came the idea to have assessors with lived experience. So it wasn't something that we had planned from the very beginning. It was a request from people during the consultation, and they said, we know most about day services, we know the kinds of questions that need to be asked, we know the kinds of things that need to be checked, and so why can't we have a role on the monitoring team? So ACE Communication took on the responsibility for employing the assessors with lived experience, including Jack, who's with us this morning or this afternoon. And so the recruitment initially was really very targeted, because this was a trial. And so we approached the individuals who were on the Day Service Voices Together group, who'd been nominated by the representative organisations, and they all agreed to become assessors with lived experience for us. And then we also approached a number of people that had been involved in the consultation, because we really wanted to include people who had some experience of monitoring and knew what it was about and knew what it meant. And so we brought people on board, and we had 5 assessors with lived experience, and it was great to be able to begin to embed them in that whole process of the monitoring team and what it would do. It was really important that we had core values, and as Deirdre mentioned earlier, we want to keep people at the centre of everything that we do. But it was also really important that this wasn't a tokenistic gesture, that these were real jobs. So as an employer, I had real expectations of the work that people would do. They are paid for the work that they do. And so the co-designing then involves that real active engagement and active listening to do this properly. And we have to be prepared to take on board the views of the assessors with lived experience and really listen to what they tell us. And sometimes that means that we go back to the drawing board with some of the things that we thought we had planned and we thought were a great idea. But then Jack and his colleagues, the other assessors with lived experience, will explain to us very clearly why something might not work. And so they've really guided and supported us to do this work in a really valuable way. Part of my role was the onboarding process, so getting everybody up and running, working, getting paid, things that might seem straightforward. But for people with disabilities, we have to think about some of the things that might be difficult. So for some people, it was their first paid job. So that might mean that they had to engage with revenue for the first time. We had to undertake Garda vetting. Some people didn't have ID. They might not have a utility bill with their name on it. So things like that were all challenges that we had to work with and had to overcome. So then moving on from there, we were able to offer people contracts. So initially 12 hours per month for 4 months to start with, and then a second contract that people are currently working on for 3 months. And we have 5 assessors with lived experience in total, 3 who were involved in monitoring visits in block 1, and now we have 5 who are going to be part of this next round. So supports for people is key. And at this stage, people are being supported, assessors with lived experience are being supported by staff from their day service. And that's been great to have that support, but we're also learning about how people want to be supported. And the assessors with lived experience are learning themselves about how they want to be supported. And some supports come from the work that they do in subgroups and the people that they meet as part of that. Some might come from meetings with myself. Some comes from meetings that they have with project managers or with Deirdre or Martina. And we've just set up a network of get to know me meetings where the assessors with lived experience get to know and spend a bit more time together. And so they can develop that kind of peer support network. And reflection and learning is really, really important. So we have to constantly reflect on what we're doing, learn and be willing to change. And that's been a new thing for some assessors with lived experience who maybe initially didn't want to tell us that something wasn't working because they knew we put a huge amount of work and effort into it. But realizing that sometimes we have to put something aside and try something different to see what really works for everyone. So the assessors with lived experience have been very busy. Initially at the start, to help with the onboarding, we developed with the subgroups a whole range of different documents. So there's a list of the documents here. I'm not going to go through them all, but I'll just draw your attention to the personal profile. So that's where we asked people to tell us what would support them to do their job really well. And so we were able to listen and think about people's physical access needs, their communication access needs, their sensory supports, any kind of medical support needs that they might have. And we're able to consider that. And with their consent, we're able to share that information with the lead assessor. And so we're able to shape up and design these roles in a way that really works for people. Also then alongside that, so they're all in an easy to read format, but the assessors with lived experience have worked not just on the monitoring visits, but they've also worked on a whole range of additional documents that we've developed, including workbooks that they're using themselves. They helped us to design the questions for interviews and focus groups and are still helping us to shape those. They helped us to work on an easy to read dictionary about the terms that we use in monitoring, a survey, for consultation with people who have just had a monitoring visit, so we can hear about how that process was for them. They help us with easy to read leaflets and reports, newsletters and videos, and they've all developed their own bio and video because people supported told us that they'd like to know who was coming to the centre and what they were going to do. And then from the consultations and from the feedback after the monitoring visits, people have asked us for a different range of things, including a photo story that Jack is going to be working on for us, a video about a monitoring visit, a discussion pack so staff can talk to people before the visit about what might happen. And there are a couple of other things there, observation tools and visual transition tools. So they're all things that we're working on, and all of these have come from the information that people gave us during the consultation. And we want to make sure that people feel heard, and we want people to know that what they tell us they need, we're going to try and do something about and put that into practice. Then moving on from there, there are just some important things that we had to think about, and I've just picked out a couple of these. So travel and access for assessors with lived experience is very important. We know that transport in some parts of the country is very poor, and that can be a real barrier to people. Professional development, preparation and support. So we want our assessors with lived experience to grow in their roles like any other employer that I have in my company or any other person that might be working within an organisation within the HSE. So we want them to be able to develop their skills. We don't want it to be a case that people come into a job that it never changes, that never moves on for them. This is ever growing, and we're trying to build capacity all the time. But we have to be really flexible in our approach. And we have to now consider how we might use technology to support the assessors with lived experience going forward. I came across this while I was working with the assessors with lived experience, and it's been pulled together by an organisation called IMROC in the UK. They're a mental health organisation, and they talked about the ripple effect of lived experience roles. And they think about the individual benefit, the service benefit, the organisation benefit, the community benefit, and then the collective benefit. And I think it's a really good way of looking at it. And I think if we're evaluating and we start to think about what the benefits are at all of those levels, we can see the amount of value that the assessors with lived experience have brought to this process for us.
Super. Teresa, thank you so much for that. I'm always struck, when it comes to involvement that is, this detailed and this organic. I suppose one of the things that comes up is the openness to risk within the system and within health systems, and in particular when you're thinking of navigating that culture of assessing and minimizing risk and the paperwork, and we all know how complicated paperwork can be. You've made some of that accessible. Was that challenging? Was it hard to change a mindset there to sort of say, actually, we do need to make this more accessible?
I think we've probably come a long way in the last couple of years in terms of making things accessible. And I think because we had the representatives from day services, so people supported on that day service Voices Together group, they were constantly reminding us about how accessible things needed to be. And it's great to see that people's expectations of getting information in that format has really changed over the last while. So I don't think it was difficult, because I think with the assessors alongside us, they kept us in that headspace, and we've been doing it for a while, but I think having them alongside us means that we're doing it better.
Yeah, I like that idea that it is influenced and it's meaningful. We might go over to Jack and Niamh now, if that's possible. And thanks for your patience and hearing, I suppose, what's been said there. But Jack, we might start off with yourself. You are one of the assessors with lived experience. Can I ask, from your perspective, how would you explain the role to somebody that hasn't heard about it before?
Basically, what I do is I go around to all different services, making sure they're up to standard. Local services around my area, and maybe in some cases it'll be beyond my area at some stage in the future.
Okay. And can I ask, how do you find it going? How do you find the job going?
I find it really interesting. It allows me to look at it from all aspects of everything, how a day services run and all that.
And can I ask, had you ever done anything like this before?
No, never, totally new experience for me.
A new experience for you. And if you had somebody else that was starting off something like this new for the very first time, what would be important, do you think, for them to hear or to make it easy for them to do something like this if it was the first time they've done something like this?
I would definitely encourage them to get involved in it, and because I find it gave me great confidence.
Okay. Is there anything in particular that you really like about it?
Just working as part of a team and being able to help fellow wheelchair users and people with disabilities.
Okay. And were there any challenges in getting started in it?
Well, I suppose there's always a few nerves when starting off, but as it went on gradually, I got into it. You know what I mean?
Okay, okay. But that's good. So you would recommend it for others from what you're saying then
Oh,
for people to get
definitely.
involved?
Yes.
Definitely.
You
Okay.
give it a shot.
Give it a shot. And the last thing I'll ask you, and then I'll come over to Neve for a second, is there any advice you've given advice, I suppose, for for people getting involved to get started with it, but from the HSE's perspective, is there any advice to staff working with people with lived experience that you'd say this is really important for you to know?
Just, I suppose, where you're going and the place you're going to, you need to know a lot of things about it.
Super. Thank you so much, Jack. And what we'll do is we'll come back to you again in a few minutes if that's
No
okay.
problem.
Really appreciate that. I'll go over to you, Neve, and maybe just from a collaboration perspective, what has the collaboration involved for you in terms of your role?
Thanks, Juanita, and thanks, Jack. I suppose, look, at the biggest thing about the collaboration, first and foremost, it's about being part of a team. And Jack has just said it, that it's for the project managers as well as the assessors with lived experience. That's the success of it. That's the nuts and bolts of it, because while we navigated kind of trialing and testing and speculating about what this might look like, at the heart of it, it was about really moving as a pack, being a team. And when we kind of were in the lead up to a visit or on the doorstep of a location, the assessor team really were that. And I think some of the greatest learnings out of that has been that while we may all have individual tasks on the day, we're all walking into the one location, we're meeting the one community of people. But what's really unique and what's really special is that we all bring a different perspective. We all are kind of coming from the lens that we've looked through and worked through. So it just, the richness of that experience and the diversity of the lens at how people do that has meant that when it comes to reflecting on what we're seeing and observing and witnessing and kind of as people are sharing with us on the ground, it's the team effort that's kind of at the heart of how you kind of walk away feeling confident about the measure of the day.
Okay. And can I ask you, I suppose one of the things that comes up is this is obviously time involved in getting this right and making sure that we're doing it right. How is it improving quality then for the people that are accessing services?
Sure. Well, I suppose in the collaboration among the team, there's also an awful lot of collaboration across the board with the wider sector in the trialing of it, but then also the community within the provider and the location that we're at. And you kind of, in your question, time being central to that. For the team to work effectively as an assessor team, we have to give adequate time with the provider, with the location, in the preparing for the visit, in supporting them, in sharing correct information with us, for us to be kind of sensitive and aware to any nuances around making sure that we're responsive to the community of people that we're going in to meet. We're collaborating and working across the national steering group and the different subgroups. We're also working as a kind of the project management team are working locally with so many different implementation leads across the regular day-to-day piece of continuous quality improvement and bringing all of that together. So I suppose for a long time, supporting the implementation of the interim standards has been part of our bread and butter. But what the monitoring trial has done and the development of monitoring has done is it's really strengthened the focus on the outcomes for the individual. So what we're really looking to do is get to the heart of, is everything that we're doing and seeking to achieve, is it having an impact on a person's life on the door, you know, when we're meeting them out in the locations in their communities. So the time to really navigate that and have the clarity that that's ultimately the measure of the success here, is that are people living the lives of their choosing, and our day services supporting people to do that.
Okay. And would you say this has helped improve that?
Massively, like across the sector, within kind of the day-to-day role of a project manager, there's 9 of us across the country, and we're in and out of locations very frequently, and we're meeting people supported, we're meeting staff teams, we're meeting kind of the management. There's an existing structure across the New Directions implementation groups, and I suppose we've a unique opportunity that this piece of work is marrying with all the work that's gone before and all the work that'll come after. And I suppose it's really focused everybody's drive towards continuous quality improvement, and really I think even maybe with the centric planning framework piece of work that's come in recent years, it's all moving together towards the one goal of supporting individuals. And there's a real appetite across the sector to be part of this and contribute to it and be involved in it. And I think the feedback that I'm receiving on the ground is providers want feedback. They want the acknowledgement of the good work. They want to know the areas for improvement. And I think what's really, really magnified all of this is that at the heart of how it's been designed, how it's evolved as we go, the voice of the person is at the heart of what we do. And the shift in that dynamic is so powerful. If you can't explain it, if you could bottle it, it would be priceless. But the value of all voices at the table together just puts us on a whole other trajectory.
Okay. And Jack, can I come back to you for a second? Has it changed how your friends talk to you about things if they know you're an assessor?
Yeah, I suppose they know I'm there if they need any help.
Okay. That's really helpful to know. Thank you for that. Okay, I might bring back in just some of the other panel if that's okay. And Deirdre, I might just start off with you just in terms of the value of the role and monitoring this. You might just speak to us a little bit about that if that's okay.
Cheers. Thanks, Juanita. And I think it has been said here today, and I think when it comes to the role of the assessor for lived experience, like there's a really strong driving force for this, and that is the United Nations Convention on the Rights of Persons with Disabilities, and you know, as well as the HSE strategies, they're a really strong driving force for this. But I think the value is, as Niamh says, it's very hard to articulate it. It really is. We're seeing such small changes, but they're making huge impacts. So for one example, what we heard in the consultations, that national consultation we did, was it's really important that people supported know who the assessors are before they come in the door. So we send bios and we send videos because of their feedback. And now we're gathering feedback after these monitoring visits, and time again, that is the one thing that people are constantly saying. People supported, staff, providers, everybody, that has been really, really beneficial, is that, you know, is so that people know the assessors. The other value is, as kind of Niamh was talking about, we want to understand outcomes. The HSE has a whole range of data, of we call it outputs in regards to the quality of the day services. But the bit we're missing is, what are the experiences and the outcomes for the person? And I suppose that's the bit where we need people to spend time with people supported, to sit down and talk to them. But we also need assessors with lived experience, because they understand what it's like to be and attend a day service. They understand when they walk in the door, they get a sense of what this day service is like from their experience. And having that lived experience helping us to understand people's experiences and outcomes is hugely beneficial. And I think that really is the value. It's going to be a really valuable resource in helping the HSE understand what the outcomes and experiences are for people who attend day services.
Brilliant. Thanks for that, Deirdre. I might go over to you, Martina, next, just to tell us a little bit about what are the next steps, you know, and I might also ask you just to touch on if someone else was starting something like this, where would you tell them to start?
So I'll start with the next steps, Juanita. I suppose, look, we've completed block 1, and you know we've had a lot of learning there, and we're incorporating that into block 2. So we're excited that block 2 will be starting actually next week, 11th of November. So that will be with providers, as Deirdre said earlier, who've expressed an interest, and there's, you know, the block 2 has been mapped out now. So we'll be moving on then to, once the feedback comes back through block 2, it's that iteration, like in getting the feedback, including it and incorporating it back in, and then we'll move to block 3. So I suppose block 3 will be quarter 3 next year. So that will be our final block, and then you know that'll form. By then we will know what the monitoring will look like. It may change, as Deirdre said, and the question around what would you tell someone, you know, to do differently? There's been so much learning. I mean, even this time last year, to see where we are this year is fascinating. You know, we didn't have assessors with lived experience this time last year, and now we've had a wealth of learning. You know, the consultation that happened last year and what families told us, what people support. So one of the things I'd say is, you know, listen, find out where people are at, and really begin that listening piece early, you know, and, you know, hear the experiences and the frustrations that are out there so we can respond to them. And then I suppose, like, developing an outcome focused monitoring system, as Deirdre said, it's complex, and it's not about really data or numbers or measuring, you know, let's measure outcomes, but it is really about, you know, building those relationships early, understanding and really listening. So I suppose there's so much learning. I don't know what else to say to you, only that, you know, keep the focus on the actual purpose that we set out to do, and that's what I would say, which is about improving services and working with people, and that's what I've learned. So yeah.
Thanks for that, Martina. There's just 2 questions coming in there, and they're sort of connected, but have the providers been selected for block 2? And somebody else has asked, have the services who expressed an interest in participating been selected and notified? So I think there might
Yes.
be people wondering, can they get involved?
So what has happened at the beginning was that there was 105 providers that expressed an interest through, at that time, the 9 CHO areas, the HSE areas. So we've used that list of providers across the 3 blocks of the trial. Absolutely anyone can, you know, we've selected our providers for block 2, and people get notified 6 weeks in advance. And, you know, then there's a whole process of, you know, gathering information and understanding where people are at. And then for block 3, we haven't selected those providers at the minute. So look, if people are interested, we won't say no.
That's super.
So I suppose just to say where would be at the day services monitoring email address, and I know Chris may have shared that already in the chat.
We might pop that into the chat, that if people have questions, you can link in directly. I just see there, are there sample of the tool used during the monitoring visits that can be brought to staff and person supported teams to review? So is there a sample of the tool that's available? Deirdre, I might come back to you on that if that's okay.
Yeah, and I suppose we are developing the tools, and as Teresa was saying, there's a lot of resources currently under development at the moment. And I suppose, as Martina would say herself, we are opening in a fully transparent way, and we're happy to share any tools and resources that we have. We just haven't fully developed them yet to share. But once we have them developed, we're happy to share, because this is all about continuous quality improvement, and being completely, you know, whatever we have that can support quality improvement, we're happy to share it when we have it ready. We just don't have it ready just right now.
It's that final sign off, as they say, and you can test and test and test, but it's the piece where you say, okay, that's okay to go out into the ether. There's a few other questions coming in there, and I'm conscious of time, so we'll move through them fairly quickly if that's okay. The easy to read information discussed in the webinar available for services to give to those availing of day services, in particular the videos about monitoring visits. So that's sort of a little bit of what you touched on there, Deirdre, but are there any resources available at the moment? Or would you be saying that will come in time?
Yeah, the resources that we have at the moment is we have a lot of resources available on the New Directions website at the moment. And I think, Martina, you can come in here as well if there's another space, but I think that's where we will be posting all of our resources in regards to monitoring that we have developed. So I suppose keep an eye out on that webpage. Once we have it ready, it'll be there.
That's super.
There's also for staff, Deirdre, the HSE Discovery Zone Hub, where we have, it's for service providers. So I think we can absolutely take that on board, Juanita. And Teresa, I know you and the lived experience, you know, people that are working with us have developed a whole wealth of documentation. So I think that's something for us to take away from this and consider and develop up a section and you know, share out that, because I'm totally, I suppose, Juanita, my big thing now is share the learning, and we've had a huge amount, and all of that documentation that's been developed in that easy read format is so focused because Jack and Jack's colleagues have been across this and it's tried and tested. So yeah, I really want to share anything we've developed as Deirdre said, once it's signed off.
That's perfect. There's just one or two very fast questions, and Niamh, there's one coming in here. Who do assessors chat on the pre-visit call? People supported in staff and day services or management from the organisation too?
So who's involved in that? Is it
in the pre-visit call?
So what's been really interesting in the trial is it's been really, really mixed, which has been a source of learning. So initially, it might end up in senior management, other times a cross-section of stakeholders. And I suppose as we're moving into the block, some of the reflections that are happening are about who are the people that need to be on the call. And I suppose where we're currently sitting with it is whoever is best placed to support that location in preparation. So if there's a representative group, we've had calls with maybe a team lead, a day service manager only on a call, and we've had many members of the kind of wider senior management team be part of it. To date, I'm not aware that we've had any of the people supported from the location on the call, but I think that might be a very exciting iteration in the future trials. But certainly when we started doing these, the pre-visit calls, it was very preliminary and very introductory, but people are really leaning into it and really enjoying them as a kind of bedding in and kind of really establishing how best to move forward in the visit. And I think the addition of the assessor with lived experience on those calls, again, has kind of elevated that whole kind of space, because what it's done is it's set the tone that from your first introduction to your assessor team, there's a crew of people coming on the doorstep, and we're all equal and we're all moving and working together to support this kind of monitoring visit.
Perfect. We have 2 minutes left, so I'm going to ask this the panel in maybe 10 seconds, because we just have a few notices as well, and I think there's a few other questions there. What we'll do is we will pass those on to Martina and Deirdre, and they might come back to anybody that hasn't had a question answered. But just literally within 10 seconds, I'll fly around. Maybe Martina, you're first on the screen here. Anything you want to leave the group with today?
Just, I think the development of a Voices Together group, and I'd love to reach out to the regional patient engagement leads that are only freshly appointed. So I think that'd be wonderful that we share this work with them as well.
Thanks for that. Deirdre?
Yeah, and I think for me, coming from, I suppose, a quality improvement background, it's really important that when you are developing a monitoring system to work with people and to ask them what are the important things that the monitoring system needs to focus on. Because we're showing that it makes a fundamental difference to what the monitoring system focuses on. So I definitely encourage people to take that approach going forward.
Thank you for that. Teresa?
I would say co-design from the beginning. So sometimes we get tempted to wait until we have it clear in our own heads what we want to do, but actually the assessors with lived experience have shown us that they're really solutions focused, and you know, you're missing out on such valuable information and expertise if you don't do it from the start.
Thank you very much. Niamh.
What I would say is when we're out meeting people, they are peppering to know, how do we get ready? How do we get part of this? What can we do? And the one message that we're constantly reiterating to people is lean into your existing continuous quality improvement processes that we're all working together on. Utilize your easy process in naming the barriers and challenges and identifying the strengths. But at the heart of it, the best preparation you can do for monitoring is focus on how you're supporting the individuals in your service to achieve their goals and to live their lives most meaningfully. So your person-centered planning and the outcomes for your individuals, that's where the real strength is.
Thank you for that, Niamh. And Jack, we'll give you the last word. Anything you want to leave people with today?
I would just say that it's given me a great platform to use my voice, this whole thing, and I would encourage anyone to take part and give it a shot. Yeah.
Thank you so much. Well, thank you very much to our panel. Just to say thank you so much for everybody that's participated on the call today, but especially our panelists who did the preparation and who have shared so much with us. So just I suppose very quickly to say to you that our next QPS Talk Time will be on Tuesday the 18th of November, and it's a conversation with the This Institute who produced the Element series. So this is attached to Cambridge University, and they talk about a series of quality improvement supports, resources available to people. And I think if anybody's interested in quality improvement, again, it's another free webinar that might be of interest. Our next one, there is a talk on implementation science supporting transformation in healthcare on the 1st of December with Professor Jeff Curran. And again, anybody that's interested, it's free to access, and you can just see the QR code there and the link gone into the chat box, but it is available for anybody to join that. Our quality coach development programs, we talk about continuous quality improvement, and one of the things that we're doing at the moment is supporting people to develop their knowledge and skills around coaching and how can you coach quality and patient safety. So you have to have existing knowledge and expertise in quality improvement methodology, but that's open for registration, and we have another 2 weeks before the closing date there. So if you're interested, now is the time to sign up for the quality coach development program for the 2026 cohort. And finally, we'd invite you to fill in the very short survey. It'll take a few minutes, but it means a lot to us to know whether this was a beneficial webinar for you to join today. And just to say again, thank you so much to you for joining, and thank you to our panel. If you want to watch back any of these episodes or share them with colleagues, you'll find it on YouTube or Spotify. Have a lovely afternoon. We'll talk to you soon. Thanks, everyone.